Lower back pain. Why does your lower back hurts? Why, when you want to exercise, it tends to get worse? So I'm going to split this first day, right, as I did, in three parts. The first part is body anatomy and body mechanics. Second part is I'm going to teach you how to relax the muscles at your lower back in a holistic approach. So you're going to pretty much need two lacrosse balls or two tennis balls, right? And one socket. Then you're gonna place the two balls here. This is on the second part, around 10 minutes of muscle release. And then at the end is gonna be around 10 minutes of stretching, of a stretching sequence that you can do that to help alleviate the pain that you feel at the lower back. That's all. Today is just body positioning, anatomy, and how to, if you're feeling pain, what can you do to feel better? This is your spine. From your coccyx, we say your tailbone, right? Pretty much your tailbone until the top of your spine. And I always like to think it's until the top of your head. So you split the spine, you could split the spine into lower back, mid back, and upper back, right? Or you have the names that they generally use: lumbar, thoracic, and cervical. So pretty much your lumbar, you see there is natural curvatures to your spine, and that's fine. But the problem is when these curvatures become excessive, they become too much of a curvature, right? So instead of this slight curvature here, now you have a bigger curvature. When you look like you have a bigger belly, a bigger butt, and you already feel the tenderness here, right? So this is your rib cage, right? Posterior, that's pretty much the back, and anterior. This is your pelvis. We are going to be talking a lot about that. Pelvis look like it's a bowl, and your spine and your rib cage that looks like another bowl. And I always like to think that you want the one bowl on top of the other bowl for better spine alignment. And you're going to understand what I'm talking about. This is a lateral view, and I'm going to show it to here for you, right? So one bowl on top of the other bowl. Not like this bowl here from your rib cage facing one direction and then the other direction. You see how it's spread out and here is all tight, right? You want this down here and this here aligned on top of each other for better breathing and better posture, right? Why we don't learn these things in school, right? Anyway, I'm not going to be critical and polemic. This is what I say, that I like to think that you would like to feel your spine lengthening, right? From the tailbone to the top of your head. You're going to listen to me talking a lot about that. Imagine a string pulling the top of your head away from your hips and lengthening vertebrae by vertebrae of this spine. Wouldn't be that a relief on your neck, on your lower back, on your mid back? Imagine. So this is what we are going to be working with, right? So one of the most common postural issues, very, very common, is the lordosis. I call it Brazilian butt. It's when your pelvis, right? Remember the image of your pelvis, instead of being straight, balanced, front and back balanced, now the front is tilting forward and the back is a little bit lifting. Imagine you have a cup of water here and now you're dropping the water on the floor because this is off alignment. So if this is happening, imagine the tension at your lower back. And if you just learn this little trick, try bringing your belly button in, you automatically relieve the pressure off your lower back, right? Or instead of, well, I'll talk this in a little bit, but pretty much the name of this is anterior pelvic tilt. Anterior pelvic tilt. Your pelvis tilting anteriorly, right? This is neutral. You see what a nice body positioning here? And here I say is Brazilian butt is what we do in Brazil to pretend to have a bigger butt. Anyway, here's a little bit easier to see, right? This is ideal alignment of your pelvis. And now this is the anterior pelvic tilt. And you see, like, looks like you have a bigger belly and a bigger butt just because this pelvis is off alignment. Imagine what happens to your digestion. Your digestion becomes highly compromised, your digestion and your breathing. I'm not going to talk much about that today. So here's another example. You see how much tension now you got here at the lower back, because now we have a pelvis off alignment that is tilting anteriorly. Start thinking if this is the case with you. And so this would be a neutral pelvis, right? Front and back kind of aligned. And then you have just 30 degrees of pressure over the vertebrae with the pelvis. Now, this other one is an anterior tilt. When the front tilts more, the back goes higher, and you see the amount of now how much you have, like the degrees of pressure over your lower back increases a lot. And imagine all these discs here, right, in between the vertebrae, how much more pressure there is on these discs, and that makes the disc, the fluid inside the disc starts dissipating, getting out of the disc, and that creates a lot of pain, right? Herniated discs. That's pretty much what it is. It can happen in your lower back, on your mid back, on your upper back, depends. That's why they call lumbar, thoracic, cervical, and they give you the letter and the number to be precise of what kind of discs are being compressed. So it's really good information. Feel free to reach out to me and let me know what's going on with you so I can help you. So why does that happen? Pretty much that happens because the muscles at the front of your hips, they become shortened and they pull your body off alignment, right? In this case here, on the one before, is pretty much your psoas that I want to show to you how it works, and some other hip flexors. This is the psoas, this is the iliacus, this is part of your quads. All these muscles, right? You see, they pass through your pelvis and they connect to your leg. So I'm going to stop the share a little bit here so you can take a better look at me. So remember what I said, your psoas is right here. They start around the side of your belly button and they go down. They run inside of your pelvis, right? And then they go and they connect to the iliacus that is around here and connect to your leg. So imagine you're sitting down most of the day working, right? You're there sitting down. Working. You see, I'm in a 90 degrees angle of my hips. Working. And how long do you spend sitting down through the day, right? Long time. We spend more time sitting down than standing nowadays. So fine, and then you're going to stand up, what happens? Now, what should be 180 degrees of your hips with the thighs and the spine, it's compromised, it's shortened. You see, instead of being here, it's here. So those muscles, instead of being long, right, in ideal length, now they are short because you spend so many hours sitting down at the sitting down position. So now you need them to lengthen again, but they're shortened. So they don't allow you to bring your navel, your belly button towards the spine again. You stay here. So there's a lot of different things that happen from here, and I'm going to talk. First one is the lordosis. Your belly button gets away from the spine because it's shortened, doesn't want to stay long, it's shortened. And then your pelvis falls into anterior pelvic tilt, and all your lower back is getting so much pressure here right now. It looks like you have a bigger belly and a bigger butt. I love when I used to go a lot to the gyms, people would come to me, how do I get rid of this belly? And I would just, fixed, ready. So these things, when you understand, it makes so much sense and you can move on from there, right? So just by yourself, try to start doing these movements here. Belly button towards your spine and away from your spine. Imagine your tailbone going between your legs and away, right? Hide your butt, pop your butt out. Hide your belly, pop your belly out. So this is a crucial movement for you to start understanding and you start feeling better from the lower back pain, right? So this is one of the issues that happen. Another issue that happens is, so let's say you're here sitting down, now you want to stand up, this is all tight. You want to go up, and then what happens? You arch in your lower back hurts instead of doing this. Another thing that happens, and I like to call it anterior, it's a tilt of your upper body. So now instead of you being upright on top of your hips, now it's like you're halfway leaning forward, right? You're not upright, navel in. It's kind of like you're locking here and you're walking around like this and you don't really know what's wrong, why you're always looking to the floor and not straight to people's eyes, right? So this is one of the reasons. So this is two of the issues that happen, and I'm gonna explain a little bit better about that. So going back to the psoas, see how attached the vertebrae around your belly button, and if it's shortened, normal length, but if it's shortened, how creates that lordosis at your lower back, and this might be the reason why your lower back hurts. Besides those, there is other muscles that can cause the same issue, right? But the most common is the psoas, the iliacus, and the rectus femoris. Rectus femoris is the muscle, the only muscle of your quads that cross the hips. Very important you understand that whenever you're doing lower body, you don't want your legs doing most of the work because that muscle is so thin. It's not strong enough to do all the load for your lower back, for your lower body, right? So this is a very good example. What happens? Ideal posture there, you almost have no belly, right? Nice posture. But now if you have the lordosis, what happens? You look like you have a bigger belly and a bigger butt, everything. And you lose height as well. Imagine like here is ideal spine lengthening, and now this is all like with excessive curvatures, and you're losing height there. And this is what I was talking about, how you end up like tilting your upper body forward instead of being upright, right? So option, what tends to happen is or lordosis here and you're all into this, or you're kind of tilting forward. You're not upright anymore, you're tilting forward because these guys here don't allow you to lengthen again from the sitting down position. So I like to talk about this because one of the reasons with the abs, for example, if you are in an anterior pelvic tilt, how are you going to engage your lower abs? Your lower abs is off alignment, right? It's all popping out there. How are you going to do abs? How are you going to get stronger abs if your spine is off alignment? You need to learn how to bring your belly button towards your spine, and then you have ideal positioning for your lower abs to be working, because it's easy on most of people to deposit body fat here. It's so hard to get stronger on the lower abs, right? Then this is tilting up. It's so easy for your body to deposit all the body fat on your lower back, because in your lower abs, just because it's sitting there, right? No matter in the position that you are. So this is crucial for better posture, better breathing, better digestion, and and for aesthetics as well. We don't want that lower abs belly fat accumulating there. So it's really important body alignment so you can strengthen your lower abs and adjust posture, right? And this is a little bit of your lower back muscles, and I'm going to show this when we are releasing the muscles so you can understand better what is tight on you. Posterior pelvic tilt. We talked about anterior pelvic tilt when these guys here are putting your hips off alignment. What about posterior pelvic tilt? Now the back, it's lower than the front, right? It's hard for me because I'm always in an anterior pelvic tilt, but it's like, and you know this in some people, looks like they have no butt, like flat butt. So it's like back, straight back here. There are two ways to be here. Or these happen when they have a flat back, or it's like the hips forward, push forward again. You hide your tailbone, and then you have a sway back like this, right? There is like this when you have like a flat back, completely flat back, or like you tilt forward and you have this arch at the mid back up, right? So now I'm going to talk about when this happens, when the back of the pelvis becomes lower than the front, right? Instead of being here, not anterior, non-neutral, now it's posterior. So it's like you have no butt at all. So why do that happen again? What is the reason? So now you can imagine that maybe your hamstrings are the muscles at the back of your leg, are shortened, and they're pulling this off alignment, pulling this lower instead of the front. So and then neutral pelvis, anterior tilt, and now it's posterior tilt. The front is higher than the back, right? And then if you look here, this is one example of a picture that shows, right? Here, flat back, flat butt, and this is anterior. one or the other. It's not hard to understand. It's just so logical. And this is a sway back posture, what I spoke about before. You see how the alignment of your spine is off. You're not on your ankles anymore. Your hips are shifting all the way forward. And you have your back here trying to compensate the lack of alignment of your hips. So you might understand that the hamstrings are tighter and shortened, and your hips are being pulled forward, right? The head pulls forward. So, all about body alignment and understanding what is the issue with your posture. Are you more like this or you're more like lordosis? What is the issue with you? And then you see how much pressure goes on the lower back, because this is back, this is way forward, and you're off alignment, right? Now, very important to understand too that even posterior or anterior pelvic shift, pelvic tilt, what happens? There is something called banana knees. Banana knees. Let me see if I can show this a little bit more distance. So when you're standing, you have soft knees, like no pressure on your knees. You're standing off your heels. The problem is, look at my knees, when there is a overstretch of the knees, right? Instead of being soft knees and you're aligned, now your knees are always stretched, and then your hips tend to push forward. So it's not possible for you to find neutral pelvis position if you have these extended knees in the back. First, a lot of pressure on the back of your knees. You probably have very thick calves, and it's very hard to find neutral pelvis here. So remember, soft knees, navel in, right? Trying to adjust those banana knees. It's very important to understand that. How you're gonna adjust those things, you need to stick around with me and take some of my classes so you understand how to do that, right? So let's go for the next slide. So this now, we are gonna migrate into anterior pelvic tilt. So if you can take a look at me again. We spoke about your pelvis and knees position, right? You can fall into this, or you can fall into this, and you can have hyperextended knees or not. Now, there is something called anterior pelvic shift. Is when your hips move off alignment in relation to your heels. Let me see if I lower this a little bit. I'm moving slowly, so maybe I don't lose focus here with the camera. So look at my heels, look at my body alignment. This is ideal body alignment, my weight over my pelvic floor, over my heels, over the arcs of my feet. And now this is anterior pelvic tilt. So now my hips is shifting forward, anterior pelvic shift. My hips are shifting forward, off alignment, because of the tension around my hips from the long hours sitting down. And then the body finds way to stay balanced. All your body wants is to stay balanced. So then the mid-back shifts back, because otherwise you're going to go straight to your head, right? Poof. So all of this is a series of compensations of your body trying to find balance and compensate the tightness at your hips and lack of proper body muscles activations, right? So you see how the alignment shifted towards the toes. Now the body weight is towards the toes and not more towards your heels. And it's very important to understand that for a lot of people feel like they have no butt, and butt being one of the biggest muscles of your body. You can see here, the gluteus maximus, right? So then it becomes almost impossible for you to have core activation and gluteus activation because of the compromised position that your spine and your hips are right now. So it's very important, not only for aesthetics, like you want a Brazilian butt, but very important to become a more functional body and, get rid of pain, joint pain. So this is some issues, common posture issues that I spoke briefly, showing, right, what tends to happen. So this, you can see that it's ideal alignment, that looks good. They say kyphosis. Here you have different names, the flat back. So here a little bit of lordosis with the kyphosis, right? This is the flat back from a posterior pelvic tilt, and a sway back posterior pelvic tilt with the mid back compromised as well, right? So try to look at yourself in the mirror without judging, with a lot of love and compassion, and try to see where your posture stands. So then how can you improve from there? And this might look a little bit too much to understand what's going on there with your posture, but pretty much here, this goes up, this goes down. That's the pelvic tilt, right? Creating the lordosis. Kyphosis is still with the anterior pelvic tilt and this shifting back. This is your flat back when you have the posterior pelvic tilt and then looks like you have nothing in the back. I've seen many people like that. And then here's posterior pelvic tilt, and this goes back to find balance. And the last one is scoliosis. Then I'm going to talk a little bit about scoliosis tomorrow, right? And this is just to you to understand how everything is connected. So you learn how to release and stretch one area. The release happens in the front and the back for better body alignment, right? In my understanding, this goes until the bottom of your feet to the top of your head. It's all connected. It's not just here until the knee. It's all connected. So when you do some nice muscle release, everything improves, right? All right, so this is the first part. This was the theory and the anatomy and body mechanics. Pretty much you're gonna be practicing this and this, this and this, and then this and this. Today I'm just talking about this alignment. I'm not talking about the other alignment when one side is shorter than the other, and that creates lower back pain as well, right? So practice a little bit. I'll be right back doing some muscle release at the lower back. So now what I'm gonna do, now I'm gonna teach you how to release the tension at the lower back with 2 lacrosse balls or 2 tennis balls and a socket. That's all you're gonna need. And doesn't matter if you have posterior tilt or anterior tilt, because in the case your lower back is very tight, coming from here or from here, what we're gonna do is we're gonna release the muscles at your lower back. First, very close to the spine, and then afterwards, gonna get wider apart. So I'm gonna put, in a little bit, I'm gonna put this screen of the muscles at your lower back. And by now, you're just gonna put one ball on the side of the other, little bit of space because this is where your vertebrae are gonna run. Then you're just gonna do a little nod here, little nod, and you're gonna place this right in between your spine, right? Not here because it makes no sense. You're gonna give a little bit of space and you're gonna put it right here. So what is your pelvis? This is your rib cage, this is your spine. So you're gonna run from upper butt to the beginning of your rib cage. That's your lower back. I'm gonna teach you how to do that. So find a comfortable position where you're laying on the floor. Make sure to keep that belly button towards your spine all the time, right? All the time. Let me adjust here. Let's see if I still have a focus here. And let's get to the lower back. Let's see. Okay, so you're gonna lay on your back. And here to start, you can do this with me. Belly button towards your spine and away from your spine. Towards your spine and away. So when you bring your belly button towards your spine and you feel almost no distance between your lower back and the floor, this is what I want you to keep practicing to keep protecting your lower back. Doesn't matter if the balls are on your back or not, right? So try to do this. Belly button towards your spine, put your feet closer to your hips, lift your hips off the floor and try to keep that body position, right? Good. So let's do that. Lift your hips off the floor. Put the 2 lacrosse balls on the side of the spine, right? At first, upper butt, so it's still a little bit on the pelvis. And then place your hands on the side, palms facing down or up, whatever you want there. Tuck your chin in and remember, you always want to lengthen it from the tailbone to the top of your head. So here, bounce your hips side to side, relaxing and trying to feel what is bone and what is muscle. So you have muscles that run on top of the bones. And for the muscle release to happen, you need to compress the muscle between the balls and a bone structure. right? You need to do that. So you need to find ways to track the muscles like that. So just for now, place the two lacrosse balls in between the spine, right in the middle. You're at the upper butt. And just try to go side to side, keeping your belly button in. Don't tilt. Keep your belly button in. That's your safe area. And you're just going to start feeling if you feel difference from right to left. Try to see if hips are level, right? Not one leg shorter than the other. Try to adjust that. And then from here, you're going to bring just one knee up and the other knee up. And you still check and keep your navel in, abs engaged. Let me open here. Inhale and exhale. Inhale and exhale. So if your right side hurts more, check. Keep lifting your right leg up and down. If your left side hurts more, check. Right? Belly button in. If this is not too much, so 0 to 10 being 10 very painful, feels like a 2 and a 3, and you want more, you want to feel it more, you want to feel the balls going deeper in the muscle, you're going to bring both legs up. You're going to try to take some nice breaths. So here you are completely exposing the lower back muscles, right? And you still can do right and left, side to side, or you can pretend you're driving a truck with your legs. Right? And this should feel so good. Feels so good. And don't worry, you're not on top of your vertebrae. You're releasing the muscles aligned on the side of the vertebrae. And this should feel like, if it's tender, just shows the muscle is very tight and it needs to learn how to be relaxed again. So if you keep applying pressure, we call this trigger point therapy. Keep applying pressure on the tightness of the muscle. This is going to bring blood flow, and you're going to be more aware of those muscles, and then you're able to relax through your breathing. Very important. Take some nice breaths and relax every time you exhale. And instead of being afraid of the tenderness you feel, you're actually relaxing on it. You're telling your body, because your body's sending you an alert, like alert state, like, you're going to get hurt, you're going to get hurt, be careful. But it doesn't know you're doing this on purpose. So it's very important that you breathe and you tell your body doing this on purpose, to your body to relax and enjoy it instead of stay all tied up and worried, right? All right, so that was the base. Now we want to shift to one vertebrae up, right? So move your hips towards your heels a little bit. Keep your belly button in. Don't let it drop. Right? Keep your belly button in, and then do the same thing you did before, just with the right leg. Breathe, keep lengthening your spine from tailbone to the top of your head, maybe just the left, or maybe both. Maybe both, if you want more. So learn, this is so clear body mechanics, right? If you keep your knees right on top of your hips, you're gonna feel that's very intense. If you stretch your legs, that's more weight over your hips. So that becomes more intense, right? Or bend, or stretch, or bring your knees towards your chest to put the muscles in a more stretched position. Keep your navel in and drive a bus with your knees all the way to the left, all the way to the right. And this should feel so good. This feels so good. You can hug your knees. If your son is around and is jumping on top of you right now, it's going to be way more intense, right? More weight you have, more intense it's going to be. Okay, you work that area, and you're trying to learn too, where is the most tender? Between what vertebrae is tighter, right? And then let's move one more time. After this, we're going to move one more time. Here, same thing. Bring your right knee up a few times. Keep your navel in. Bring your left knee up a few times. Keep your navel in. If you want more, bring both legs on top. This one, I like to hug my knees because now I'm exposing a lot. You can still drive a bus, right, with your knees, or just stretch your legs like that. This is way more body weight on it, way more pressure, and you still can drive a bus like that. Keep breathing. And try to relax with the tenderness. Don't arch. Keep your belly button towards your spine. Hug one leg only or hug two, right? Find something that works better for you, and don't be afraid of the pain signal. Keep exploring it. You cannot get hurt like this. You're just doing good for yourself. Keep your navel in, lower ribs in, keep lengthening the spine. And let's go for one more spot. Almost at your rib cage now, and same thing, one leg at a time, or both legs, drive a bus, or stretch your legs. I like to do this too, like push one heel up and then the other, right? Or move the hips. Find something that works for you and relax. Take some nice breaths. Option 2, you go from the lower ribs to the upper butt. If you have like a shirts that can get trapped, just be careful with that, right? And you can roll like this. This feels good too, but don't arch. Keep your navel in, keep exposing the muscles at your lower back. All right, to get out of this, always, anytime you want to sit up again, turn your knees to one side, put opposite hand against the floor, and push yourself up. All right, so now we're gonna work a little bit more on the outside muscles because it can be your lower back, but not necessarily right here. Maybe you're feeling tightness a little bit more to the sides. So the socket is just to not allow the balls to escape and roll around, right? So you trap them inside of the socket. If you widen it up here, the space between both balls, you can find different areas at your spine that you want to work, right? Here to here. It'll be wider apart, lay down. And I really like this area because I know by a fact that I'm really tight on the sides of my butt, and that tension it runs in lines, right? So you might be more tight here on the lateral line of your body, or maybe more in the inner part, right? Or maybe just the front. It's things that you figure out by practicing. You need to practice. So you learn through practice and not necessarily through success, right? So anyway, so now I'm a little bit more like on the outside of the line, and then we can do the same things we did before to find release here. Both knees at the same time or alternate. Oh, this feels so good. So some people are really good at muscle release. I'm one of them. Like, I enjoy it. I really like to feel the tenderness. Some people are not very good with it. They tie up and they stay scared. But it's all about practice, breathing and learning, right? And not being scared. Not being scared. Definitely. It's just muscle tightness. You're not hurting any tendon, any ligament, or anything like that. All right, so upper butt to a little bit higher on the pelvis, right? Beginning of the spine. You can do that side to side. Both legs up and down. Ooh, this is like being stabbed. Hug your knees and feel that nice release at your back. This feels so good. And it's almost like a stretch at the same time because you know how this is elevating my pelvis and allowing my spine to go a little bit more towards the floor. So it's a mix of a stretch on the sides like this. The spine right now, the muscles around the spine are opening up on different directions just because you put a little bit of a lever here. Take some nice breaths, hug your knees, tuck your chin in, and melt into it. Relax. Drive a bus if you want. Move hips side to side. Stretch your legs all the way up if you want. And you can keep working here until your rib cage. In the case of the rib cage, underneath your rib cage is very important. And this time then tuck your tailbone under and bring your hips down because this is where the diaphragm is. And I'm going to talk about this in another class. Where your diaphragm is. If you are not breathing properly through your diaphragm, your lower back and mid back are going to tense up a lot because they're going to try to do the work of the diaphragm. So breathing is highly connected to lower back pain, highly connected. So releasing around the rib cage, it's really good for breathing, to optimizing your breathing and to improve posture and addressing lower back pain, right? Here, same thing, hug your knees or stretch your legs. If you want to check a little bit more, lean over the left side and come back, or lean over the right side and come back. Oh, this feels so good, right? This is getting the muscles in different areas that are tight, and this is going to give such a big release at your lower back. Right now, I have one here that is tight as hell. Take some nice breaths and always looking for a lengthening of the spine. So these you can practice on your own, or you can get the video and practice with me, because the basics are the same. You're trying to press the muscle against some kind of bone structure, lengthening the spine, engaging your abs, taking some nice breaths, and learning with your body, not being afraid of the tenderness of the pain signal that you feel. All right, let's take the balls away, and we are going to go for a sequence of stretching now. So remember, every time you want to sit up, turn your knees to the side, put your hand in front of your chest, and push yourself out, right? And now you're going to go for a little stretch. So first, let's put that spine into a stretching position, right? So here we can start with all fours, and you're learning how to move your pelvis. So you don't want to go here because you're tight. You don't know what to do yet with your posture. You just don't want to feel pain right now. This is where we are right now. So you're not allowed this to happen. You're not going to allow this to happen. You're going to be training from here to here, here to here, right? And this itself is already going to give you some nice lower back relief. And we're starting with this movement here to release, to stretch the lower back muscles that are tight. Neutral position. Now belly button deeper in, push your lower back to the ceiling. Send your hips away from your mid back. Again, neutral. Push your lower back to the ceiling. Neutral. Push your lower back to the ceiling. Now keep your lower back to the ceiling and take some nice breaths. Inhale and exhale. So stretching has everything to do into relaxing the muscles that are tense and shortened. Keep breathing and practicing like you're sending airflow all the way to that area and feeling the body from inside out. The breathing is happening inside of that chamber between pelvic floor and rib cage and the core walls, right? Front, back, and sides. Can you send some airflow all the way to your lower back? Let's check. Try and look at yourself. From this position, you're going to turn around. You're going to lay on the floor, and we are going to do this. Bring your belly button in. Not away from your spine. Don't let it arch. Keep your spine long. Adjust your hips away from your rib cage. And now bring your knees. And you're going to take 5 nice breaths here. Hugging your knee towards your chest. Lengthening your spine in the back. And trying to feel this stretch between upper butt and rib cage. Upper butt and rib cage. You're getting big distance between each other. 2 more belly breaths there. Let's do one more. And this itself already is going to feel a nice stretching at the back. It's going to give you nice relief at the tenderness that you feel at the lower back, just because you're changing the body positioning of excessive tension there, right? So again, put your feet on the floor, push your knees to the side, hands on the floor, sit up, right? So now we are going to do a few more stretches here from this position. Sorry, I could have started from the other position. Maybe when I edit this, I'll change. So anyway, you were here to here, right? Here to here, not here to here. You don't need that right now. You learn how to do that afterwards. So now keep your belly button in, send your lower back to the ceiling, and sit back into a child's pose. Keep sending your hips away from your hands. Navel is in. Take some nice breaths to connect the body with the mind. So instead of thinking about other stuff you have to do today, you're going to keep feeling your body from inside out and believing in what you're doing. So this is your rib cage, and your rib cage in the sides and at the back are getting far away from each other, putting all these muscles into a stretch. You can even tuck your chin in, put your forehead on the floor, and use your hands to spread the rib cage away from your hips. Put your fingers around the spine and feel the tension. What is bone, what is muscle? With your hands, you can massage yourself a little bit and work on the lengthening between tailbone to the mid back, or right to left, spreading those guys, right? Here, arms on the side, elbows on the floor, triple elbows on the floor, and push your hips further away from your rib cage. Keep your neck long, avoid the chin popping up. Keep breathing. And now if you can, you're gonna bring both hands, both arms a little bit more to the right side, and you're gonna feel a better opening at the left side of your hips. So my arms are going a little bit more to the left, to the right, and there is a better opening on the left side of my lower back. Take some nice breaths again. So your hips are going straight back towards your left hip, and your arms to the right. Belly button is in, and you're feeling that nice stretch. And now both hands to the left, and you're gonna feel the nice stretch at the right side of your back. Through the angle here, I think it's better. Both hands to the left, hips back, and all of the lower back on the right side is opening up. Take some nice breaths here, and keep feeling the hips getting further away from your rib cage. Back to the middle. You're gonna go to all fours. And from all fours, this one you can use the chair if you're a very tight person, right? Tuck your toes under, navel is in, push your spine all the way up. Try to stretch your legs and try to stretch your spine. Here, ideally on the downward facing dog, you kind of want a pelvis like a little bit more straight, but in the case we're trying to protect your lower back, so keep your navel in and keep stretching your spine and your legs. Inhale and exhale. If this is too hard for you, grab a chair. And you're gonna do this with the chair, getting a bit more range of motion. And you're lifting your hips away from your heels, taking a look at your feet. If your feet are straight forward, right? Try to stretch the back of your knees. Try to feel your rib cage getting further away from your hips. Take some nice breaths. Try to not just drop your head like this. Keep your neck aligned with the rest of the spine. Tailbone getting far away from the top of your head. Now let's bend just the right knee. Bend just the right knee and focus on stretching the left side a little bit more. Never with banana knees. No banana knees, soft knees. Right knee bends, and now just left knee bends. Inhale, bend right. Exhale, bend left. Inhale, bend right. Exhale, bend left. And now one of my favorites, you take the hands off the chair and you fall into anterior fold. Adjust your feet to make sure they're straight forward and you're not collapsing the arches, right? Not collapsing the arches. You have a nice arch on your feet, knees aligned, and then you are in an anterior fold. Very important for the anterior fold is like, you don't really want your hips back like that. Try to find your hips over your heels. Your hands don't need to touch the floor. You can hug your elbows. Tuck your chin in. And now imagine from rib cage to the top of your head is a pendulum. Stretching your lower back. Push your right shoulder away and then your left. Right and left. Right and left. Pump a little bit if you want. No banana knees, right? Soft knees, and keep working with the hips on top of your heels. Take some nice breaths. Inhale and exhale. Drop the weights at your heels, not at the balls of the feet. Inhale and exhale. Feel where the tension is. And one more time. Inhale and exhale. And one more time. Inhale and exhale. Whenever you're ready, bring your knees down. And pretty much this is what it is. Try to practice those until I see you next time. Tomorrow, we are going to be talking about this right? Instead of being a line here, one side now is lower than the other. That can create scoliosis, but to get to the scoliosis level is because you ignored this for a long time and your body found another way to compensate it, right? Now, if you learn how to adjust this, your lower back is going to stop hurting if this is the case, right? That happens a lot when people go to the chiropractor and they say, you have a shorter leg, but actually you don't have a shorter leg. You just have the tension at the hips and the leg way bigger in one side than the other, right? So one leg, your hips, instead of being here, now it's here. And it's pretty much because this is all tight, because maybe you always cross your legs on the same way, or you always stand like this, right? So your body just adapts to things that you do consistently. So anyway, I hope I could plant some seeds on your head today. And hopefully I'll see you soon.